Hi, I'm Dr. Jen Kalish. I'm a physician scientist and a clinical geneticist studying Beckwith-Wiedemann Syndrome. And as many of you know, Beckwith-Wiedemann Syndrome is an overgrowth and cancer predisposition disorder that affects children. Up to 25% of these children develop tumors, and we don't know why they develop tumors. I first got involved with patients with Beckwith-Wiedemann Syndrome several years ago when a little girl came to see me in clinic with slight hemihypertrophy. One of her arms was a little bigger than her other. And we started screening her for tumors, and when she was 18 months old, she developed a tumor. And her parents' question for me, which I couldn't really answer at that point, was why did she develop a tumor, and how do changes that cause Beckwith-Wiedemann syndrome lead to cancer? To understand this, I've developed several lines of research, including starting a patient registry of patients with hemihypertrophy and Beckwith-Wiedemann syndrome to understand what risk factors lead to tumors in these patients, and to also develop several lines of basic science research, both using human tissue samples and cells to understand why the genetic changes that cause Beckwith-Wiedemann syndrome lead to cancer, and also developing new mouse models. This research and studying Beckwith-Wiedemann syndrome is important for several reasons. One is to understand why the children with Beckwith-Wiedemann syndrome develop tumors and overgrowth and other health problems, but also the same genetic changes that cause Beckwith-Wiedemann syndrome cause a number of other types of cancer as well, and we don't understand why those cancers develop. So I thank you for your support today and look forward to continuing our conversation, as it's very important that both families and friends of families get involved in this research so we can continue it for this purpose. Thank you.